Hello my precious friends, I really hope that you're doing great. Welcome to today's class. It's our 7th lesson on scientific investigation. So today we are looking at the common laboratory accidents and their related first aid measures. Now our very first common laboratory accident is what we call the cuts. Now the cuts usually result whenever sharp or pointed objects penetrate the skin, causing the cuts. Remember, the cuts usually lead to what we call bleeding. Now, what are some of the first aid measures that we are supposed to take in case of a cut in the laboratory? One is that we are supposed to wash the cut wound using clean water, of course, free from infections. The second first aid measure is that we are supposed to disinfect the cut wound. Remember, whenever we talk of disinfectants, these are simply, they are used on non-living surfaces. For example, what we call the lab benches where we want to perform our practical. Then the third first aid measure is that you're supposed to apply what we call antiseptic solutions to the cut wound. Examples of antiseptic solutions in the laboratory, we have the hydrogen peroxide. Remember, antiseptics are simply used on living tissues. These ones are now used on living tissues, for example, the skin, to kill the microorganisms causing infections such as the bacteria, virus, and the fungi. Now, the fourth first aid measure in case of a cut is that you're supposed to place a dressing and a bandage to hold the cut wound in a place. Of course, this one is going to reduce bleeding and prevent contamination of that particular wound. Now, the next first aid measure is that you're supposed to visit a health center in case the cut actually needs the stitches. Remember, when we talk of a stitch is simply a thread which is used to hold the edges of the wound together. Of course, this one is going to fasten the healing process. Now, our next common laboratory accident is what we call the burns and the scalds. So a burn, or simply burns, are simply soft tissue injuries which are caused by chemical hazards, electrical hazards, or what we call the radiations. Whereas whenever we talk of scalds, these are simply soft tissue injuries, of course, which are caused by that is the hot liquids or even the steam. Now, the first aid measure that we are supposed to take in case of burns or scalds is that, one, we are supposed to run the burned area under cold tap water, that is with low pressure, for about 10 or 15 minutes. Of course, this one is going to clean the wound, and of course, with low pressure, that is not going to cause more harm to that particular wound area. The second first aid measure is that we are supposed to study the size, depth, and location of the burned area, so that if necessary, proceed to the health center for further medication. The next first aid measure is that cover the burned area with a loose gauze dressing, or what we call a clean piece of cloth. Now, whenever we talk of a loose gauze dressing, so a gauze dressing is simply a cotton material used to clean, cover, and absorb the fluids from the wound and protect it from further contamination. So cover the burned area with a loose gauze dressing or a clean piece of cloth, and you need to be careful not to puncture the blisters. Now, what is a blister? A blister is simply a small bubble-like elevation on the skin filled with blood or pus. Those are what we are calling blisters. They are usually filled with clotted blood, or what we call the pus. The other next, that is first aid measure. In case of chemical burns, you are supposed to remove any cloth contaminated by that particular chemical, as long as it is not stuck to the skin. Then do not apply any lotion or any other remedy to the burned area, because you could end up worsening the case. Then in case of electrical burns, you're supposed to stop the flow of electricity And of course, the rescuer must be on a rubber or a wooden surface. The reason is because rubbers and wood are poor conductors of electricity. Therefore, the chances of being electrocuted will be very low. Also, remove the injured person from the source of electricity using a plastic or a wooden object. Remember, plastics are poor. They are poor conductors of electricity. Poor conductors of electricity. So, to prevent that electricity from harming the person rescuing the victim, you are supposed to use a poor conductor of heat. For example, wood, plastic, or rubber. Also, if the person is still holding the socket, you are supposed to hit the person using a wooden material, which is a poor conductor of electricity, to disconnect the person from that particular electricity so as to rescue the person from electrocution. Then the next common laboratory challenge or hazard is what we call injection of harmful substances. Of course, harmful substances can enter the body through the mouth, that is, or by swallowing them. Now, what are some of the first aid measures we need to take? So if the victim is unconscious, when we talk of a victim being unconscious, we simply mean that the patient is not responding to any stimulus. For example, the patient does not respond whenever they are called or they are tapped on their shoulder. In such a case, we say that the patient is unconscious. That is, he's not able to detect any external stimulus. So for such a case, the first aid measure you need to take is that ask for urgent medical assistance, because the patient is in a very critical condition. Then also put the casualty in a recovery position. Then you are also supposed to loosen the cloth. The purpose of loosening the cloth is to improve the blood circulation and prevent overheating of that particular patient. So loosen the clothing and wrap the victim in a warm blanket. The purpose of wrapping the victim in a warm blanket is to regain the normal body temperature. So this will help to stabilize the patient. For example, the blood of that particular patient could be at very low temperature, but when you wrap them in a warm blanket, the temperature is going to increase. Therefore, the patient will be able to regain the normal body temperature so that they can function normally. Then also, in case of unconscious patient, do not induce any vomit. So if the victim vomits, clean up the respiratory tract or cover your fingers, so with the fabric, to clean the victim's mouth. So the importance of cleaning up the respiratory tract is that for efficient breathing, that is to allow the patient to breathe efficiently. So this also prevents infections and maintains the overall lung health of that particular patient. Then also do not administer anything orally to an unconscious victim. Of course, this one is likely to worsen the situation. So for example, the reason why we are not supposed to administer anything orally or through the mouth is because this can lead to choking, coughing, or interfere with the breathing system of the person, worsening the situation. Then do not try to neutralize the toxic products in case the patient inhales some toxins. The reason for that is that mixing the wrong chemicals can lead to violent reactions, producing toxic gases, intense heat, or explosions, causing secondary injury within the body of the patient. But in the case if the victim is conscious, now conscious of course means that the victim of course can respond to external stimuli. For example, when you tap them on their shoulder, they are likely to recognize that particular tap. If you call their name, they're likely to respond. So if the victim is conscious and toxic substance is corrosive, that is, the toxic substance within their body is highly corrosive, then in such a case, you're supposed to make the victim drink plenty of water. The reason for that is that plenty clean water dilutes the water-soluble toxins and also supports the natural body detoxification process through substances or through organs such as the kidney. Remember, the body has its own natural detoxification process. So if the patient drinks a lot of plenty water, the plenty water will dilute the water soluble toxins and also support the natural detoxification process within the body. Then do not induce any vomit. The reason for that, we said, is that it can cause secondary poisoning of the mouth, throat, and also the esophagus. Then, of course, if the case worsens, take the victim to the nearest health center. Thank you very much for accompanying me until the end of this particular lesson. I do not take it for granted. In case you're new to the channel, kindly hit the subscribe button and also turn on the notification bell so that whenever I upload a new video, you will get notified. Until next time, this is Kind Tuition Academy. Thank you very much.